Presbyterian Turquoise Care 2024 Handbook, page 64, Chapter 2, Covered Benefits Continued. Meals and lodging. Presbyterian Turquoise Care will pay for lodging, such as a hotel, for members who must travel more than 4 hours one way for medical services. Unless you have an emergency, Presbyterian Turquoise Care must approve your request for lodging reimbursement before the trip. Presbyterian Turquoise Care will pay for meals for members who must leave their home community for 8 hours or more for medical services, if your medical travel is for 5 or more days. Speak to the Presbyterian Turquoise Care travel representative about your meal reimbursement options, unless you have an emergency. Presbyterian Turquoise Care covers transportation, meals, and lodging for one attendant if the member getting medical services is younger than 18 years of age. The attendant for a member younger than 18 years of age should be the parent or legal guardian. If the member is 18 years of age or older, the member's medical provider must put in writing that an attendant is medically needed. Presbyterian Turquoise Care will not cover transportation, meals, or lodging for attendants under 18 years of age unless you have an emergency. Reimbursement for meals and lodging. To be reimbursed, which means paid back for meals and lodging, call the Presbyterian Customer Service Center to ask for a reimbursement form. Make copies of the original receipts and of the form and keep a copy for your records. You must send the form and original receipts within 90 days of travel to Presbyterian Turquoise Care, Presbyterian Customer Service Center, P.O. Box 27489, Attention Claims, Albuquerque, New Mexico 87125, 7489. The maximum amount Presbyterian Turquoise Care pays for lodging and meals is based on the New Mexico Medicaid rate. The items we do not pay for include, but are not limited to, in-room movies, telephone charges, room service, food delivery service, laundry, rental cars, alcohol products, tobacco products, tips to restaurant servers, and other convenience items. Page 65. Out-of-state transportation, meals, and lodging. Presbyterian Turquoise Care must pre-approve all out-of-state transportation, meals, and lodging. We will approve out-of-state transportation only for approved out-of-state medical services. Air and ground ambulance, in-state and out-of-state. If you have a medical or health emergency, dial 911 or the emergency number in your area. Do not call the transportation partner. The transportation partner does not coordinate with air or ground ambulance transportation. If you need an ambulance for non-emergency transportation, your provider's office, or a care coordinator should call the Presbyterian Customer Service Center. Vision services. Presbyterian Turquoise Care helps you take care of your eyes. It is important to have your eyes checked regularly, which means often. A routine eye exam can find serious health problems, plus eye exams for children can find problems that can affect the way they learn and develop. Presbyterian Turquoise Care covers certain vision care services needed to diagnose and treat eye diseases and to correct vision. Medicaid has specific guidelines for when eyeglasses and contact lenses are covered. Routine and medically necessary eye exams. Routine eye exams and eye exams for medically necessity are covered by Presbyterian Turquoise Care. Children under the age of 21 years are limited to one routine eye exam in a 12-month period, or when care is medically necessary, which means needed. Adults over 22 years of age are limited to one routine eye exam in a 36-month period. You must choose an eye care provider in the Presbyterian Turquoise Care Provider Network. These eye care providers are listed in the Vision Care Practitioners section of the Presbyterian Turquoise Care Provider Directory. You do not need a referral for a routine eye exam. If you need an eye exam due to a medical reason such as diabetes, find a provider listed in the Vision Care Practitioners section of your Presbyterian Turquoise Care Provider Directory. End of page.